introducing. So now I'd like to introduce our two speakers for today. We have Sarah Askew. She is with the Statewide Senior Action Council, and Eric Hausman. He is the Medicare consultant to the New York State Office for Aging. So Sarah, why don't you go ahead and take it away?
Good afternoon, everybody. I'm going to put my information in the chat for you as well. I am from the New York Statewide Senior Action Council. We're a nonprofit, nonpartisan organization that advocates for seniors and their families. We help with Medicare, navigating Medicare choices during open enrollment. They can call us, get unbiased information to help choose a Medicare plan. We do patient rights issues. So if you have anything like that, they can call us. And we also do Medicare fraud and abuse. So I'm going to talk to you a little bit today about things that are specifically during open enrollment. There's a lot of fraud that comes up. It happens year-round fraud, but there's a lot specific with open enrollment. So I'm going to talk to you a little bit about that. We are a free service. You don't have to pay anything to use us. You can give my number out, give that 1-800 number out to literally anybody. You can call me, they can call me. We're happy to help. And like I said, we're unbiased, nonpartisan, nonprofit. So I'm going to share a quick presentation with you to tell you a little bit more about. Can everybody see that okay?
It's in the second floor. Wait 1 second, okay?
Can everybody see that okay?
Yeah, we can see. Yep.
Okay, perfect. Wonderful. Okay. So in 2018, we got the Senior Medicare Patrol Grant from the U.S. Administration on Community Living, which deals specifically with Medicare fraud and abuse and Medicaid fraud and abuse. And that's designed to empower and assist beneficiaries, their families, advocates like yourself, to find and report healthcare fraud, errors, abuse, and know how to protect themselves. So we do this through community outreach, educational presentations like this one. We have a lot of great information. We have flyers. Feel free to contact me if you'd like some. I can send them to you to send out. If you know people that would benefit from it, some great information. We also have certified unbiased counselors such as myself to provide assistance. And we do work with the Office of the Inspector General to resolve cases of fraud. And we do have counselors across New York State. So we are truly statewide. So if they're not in your area, but you have friends or family, feel free to give them the number because we're happy to help. And we also have volunteers that are throughout the state. They are the eyes and ears of their community. They let us know when something pops up. Because if we don't know something's going on, we haven't heard about it, we can't advocate and we can't work against that if we don't know it's out there. So really, we encourage people to call and tell us about things that are happening and stuff that they're seeing so that we know what's going on. And they can also present information and help in their own community. There's a lot of stuff specific during open enrollment just because everybody is getting bombarded with information about changing your plans and different things that you can do. There are some dishonest brokers out there for insurance, unfortunately, which makes it a little more complicated. And the Centers for Medicaid and Medicare Services started a Look Out for Enrollment Fraud video, which I'm going to share with you. It's about 5 minutes, just to give you an overview of some of the information of what to look out for. So I'm going to play that for you. Not very long, but it'll give you an idea of some of the stuff that's been happening.
I can't hear the video. I'm not sure why.
Sorry about that. Not sure why it won't. Can you hear that?
No, I'm not hearing it.
Oh, wow. Well, I can send you the link for it specifically. I'm not sure why it is not playing. I'm not really sure why it's not working. just checking, see if I can fix it, but I'm not really sure why it is not working. So I can send you the link separately, I guess, if you want to send it out to people so they can watch it. I'll tell you because I've got the next thing about what the different stuff is. So it talks about some of the different things that happen with brokers. So some of the things to know is that brokers cannot contact enrollees directly without prior permission. They can't just cold call people up and talk to them about plans. That's not how it works. They can't pressure enrollees with false timelines and offers of non-existent early bird discounts. Sometimes they'll call and say, you have to do this right now. You know, it's immediate. You have to get in on this. Everybody has until December 7th to make a choice. They can't offer free gifts of more than $15. So sometimes they'll say like, oh, you get an iPad. If you enroll in this plan today, you'll get this free gift. They can't do that. They can't cherry pick, which is when plans enroll people that are healthy into their plans, and they might do some kind of a screening to kind of rule out people with more health issues and only enroll people that are really healthy in the plans. And there are some dishonest brokers that actually work with like nursing homes and retirement communities to enroll people without their knowledge. So you want to make sure that they're checking their MSNs or their EOBs that they get in the mail and reviewing those. Those are the summaries that Medicare sends. They're not bills. They just provide them with the information of what they've had in the last 3 months. And if they have any issues or they think that there's a problem, they can absolutely call me and I'm happy to help them with it and go through it, and we can check all that. This is an example of mailings that go out, and you can see where it looks very concerning. It's got please call immediately. It's got the limited hours, immediate response requested. And this is something that they send out for, you might be able to receive additional benefits, which is something they talk about with the Medicare Advantage plans. But it seems very much like they have to do it right now, and it puts a lot of pressure on beneficiaries to make a change. And like I said, they have until December 7th. They don't have to change their coverage if they don't want to, unless their plan is ending for some reason, which they would receive notification about. But they can always call us, and we're happy to just go through it with them and just check and see if what they have still works for them. To give you an idea of an example of this, I had a beneficiary that a Medicare Advantage plan called her, and they actually enrolled her, even though she said she didn't want to enroll in the plan. They ended up enrolling her anyway. We were able to contact Medicare, get it stopped so she could stay in the plan she wanted to stay. And we work with the Department of Financial Services to report those cases. And then we follow up with them to make sure that they have all the information that they need so that they can then take the sanctions or whatever steps they want to take against the broker. If it's a fraud case, we'll refer it to the Office of the Inspector General. We get all the information together, we write out a narrative, and we submit it to the OIG, and then they can investigate it further for fraud cases as well. And then we follow up with the outcomes, keep those cases open so that we can see what happens and what happens going on with that. Some tips to tell your beneficiaries when you're talking to them is keep a healthy sense of skepticism. If it sounds too good to be true, it probably is. Sometimes they'll call and they'll say you can get money back, you can get all this extra coverage, so just make sure that they know what they're getting. Talk to someone, a trusted source, like an advocate in the community that they trust, friends or family, have them call us so that they can talk about their options and know really what they're getting. Don't let anybody pressure you. You have time to make the best decision. Beneficiaries have from October 15th to December 7th of every year to make changes. And there's not going to be a situation where they have to make a change, early, that they really try to push that time constraint to make it seem like they have to do it immediately. Our 1-800 number is 1-800-333-4374. I know some of you are on the phone. And you can have them call anytime. They'll get a counselor. We have somebody in Buffalo. I'm in the Ithaca-Dryden area. We have somebody in Albany and New York City. So you can call anytime and you'll get one of us, and we'll definitely be able to help you with the situation. And just know your rights and know beneficiaries' rights. Brokers have to give you the information only about the items that you've asked them to talk to you about. And they can't set their own time limits. Everybody, like we said, has till December 7th. They don't have the power or the authority to say that you have to sign up early. They can't threaten a way to take away your benefits if you don't sign up with them, and they shouldn't be offering you gifts, like we said, over the $15, and if you agree to sign up for their plan. They cannot suggest that Medicare endorses or prefers their plan. Medicare doesn't endorse or prefer any particular plan. and pick the plan that's right for you. Make sure you get your information. If they're working with a broker, get it in writing. Don't just take the broker's word for it. Like, ask for writing about the plan so that they know exactly what it is that they're getting to verify the details. And I always tell people, protect your personal information. Treat your Medicare number like your social security number or your credit card information. If I called you up and I said, hey, I want your debit card information because I really need it and I want to go shopping, you wouldn't give it to me. So that's what I tell people about their Medicare number. Don't give it to somebody who calls you over the phone. A lot of people are pretending to be Medicare. They're even faking caller IDs. So it says it's Medicare calling, and they're not going to ask you for your social security number. They're not going to ask you for your Medicare number. Hang up, call me, call Medicare, and we'll get it reported and taken care of. You can also go to our website, which is www.nysenior.org. We have a lot of great information on there. We do health hubs monthly, we do teach-ins monthly, and we put the videos on the website, which are always free and available for people to watch. You can call us at the hotline, which again is the 1-800-333-4374. You can also call us if you want us to do a presentation for your group. We have presentations on Medicare Fraud. We have Medicare 101 presentations. Call us and talk to us about your needs, and we can put something together. And it's free to have us do presentations. If you want to get materials, feel free to call me. I'm happy to send you flyers. We have a lot of great information. And we also have information about volunteering with the SMP program. If you know anybody who might be interested, it's a great way to really affect change in your own community and really protect the people that you know and love, and make sure that you have the most up-to-date information about Medicare fraud and how to avoid and protect it. And I'll have to send Nancy the link. I apologize for the video to send out. It's not playing with sound. I do apologize about that. So that's it for me, just to let you know to look out for, like I said, during open enrollment. But Medicare fraud is a year-round condition, happens all the time. It's billions of dollars a year in fraud, and it affects everybody. If you pay taxes, it affects you. So always be on the lookout for it. If you have friends or family, or you know anybody that might have been a victim to it, a lot of times they feel really ashamed, but they're not alone. And it happens to a lot of people. And please have them call us, because we're happy to help, and we'll walk them through it. We'll help them report it and get it all taken care of, and make sure everything's all safe and sound for them, and help them that whole process. And if you have any questions, feel free to call me or email me anytime.
Thank you, Sarah.
Thank you. I'm going to pass it on to Eric. I know he has a lot of great information about Medicare for you.
And I just wanted to let everybody know I looked that link up on YouTube and I put it in the chat for that video.
Thank you, Nancy. I really appreciate it.
You're welcome. Thank you. All right, Eric, you ready?
Yes. Okay. Thank you, Nancy. Thank you, Sarah. So I'll be presenting a Medicare update. And the first thing I wanted to review was about the Medicare enrollment periods. Now, for those that are collecting a Social Security benefit prior to their entitlement to Medicare, prior to age 65, they're automatically enrolled in Medicare Part A and Part B. But nowadays, more people are collecting Social Security after 65. And for them, enrollment in Medicare is not automatic. It's up to them to enroll. And you could only enroll in Medicare Part B during one of the Medicare enrollment periods. The initial enrollment period, when people are first eligible for Medicare, the special enrollment period for people that may be able to delay enrollment because they're still working or covered under a spouse is still working, and the general enrollment period, an annual period in which anybody can sign up for Medicare Part B. So let's go through each of those. So the initial enrollment period, for most people, it's the 7 months surrounding the month they turn 65. So the 3 months prior to the month they turn 65, the month of, the 3 months after that. If you enroll in Medicare Part B in any of the 3 months prior to the month you turn 65, Medicare Part B starts the first of the month you turn 65. If you enroll the month you turn 65, Part B starts the first of the following month. But you have to watch for the people that enroll in the last 3 months, because their Part B will be delayed. So if you enroll the month after the month you turn 65, Part B will not start until 2 months later. And if you enroll 2 or 3 months after the month you turn 65, Part B will not start until 3 months later. Okay? And nobody knows that until they actually fall into that situation. Now, for the people that are still working or covered under a spouse is still working, especially if they're working for a large employer where the employer insurance would be primary, they will often delay enrollment in Part B. Why? To save the monthly Part B premium. And then they will enroll later without penalty using this special enrollment period. The special enrollment period allows you to pick up Part B while you're working or within 8 full months following the month you're no longer covered through active employment. So if come 65, let's say you're covered under your spouse who's working for the state of New York, you may want to delay enrollment in Part B. And then a few years later, when your spouse is ready to retire, you can sign up for Part B at that point, again, with the special enrollment period, without having to wait and without paying a penalty for late enrollment. And those are the only people that can delay enrollment in Part B without penalty. The people that are covered at 65 under their own or their spouse's active current employment. Because for the people that don't enroll during the initial enrollment period and who don't qualify or maybe miss the special enrollment period and then realize later they need Part B, they make them wait till an annual period called the general enrollment period. If you sign up during that time, it's January through March, and Part B doesn't start until July 1. And these are the people that are subject to a late enrollment penalty. The late enrollment penalty, it's 10% of that year's standard premium for every full 12 months you delay. And that 10, 20, 30, 40, 50, 100% or more penalty, it's not a one-time penalty. It is a lifetime penalty. So again, just to reiterate, the only people that can delay Part B and not be subject to the penalty are the people that are covered at 65 under their own or their spouse's active current employment. Now, in case you encounter somebody that has just Part A of Medicare and does not have Part B and is not in a Part B enrollment period, the first thing to screen them for is the Medicare savings programs. The Medicare savings programs, for those people that qualify, the state will pay their Part B premium for them. It will eliminate any late enrollment penalty. And if they're not enrolled in Part B already, it will enroll them into Part B without having to wait till next July. There are 3 Medicare savings programs you see here. The one with the highest income limits is the QI program, up to $14.69 a month for a single, $19.80 a month for a couple. And a couple of advantages to living in New York State. For these programs, they don't look at your assets or resources, only income to qualify. And on top of that, even if your income's a little too high, you may still qualify. Because if you're paying privately for health insurance, they allow you to deduct your health insurance premium from your income when you're applying for this program. Now, you cannot deduct the Part B premium because this program pays the Part B premium, but other premiums you can. So such as a Medigap premium that we'll talk about later. Some people have long-term care insurance. That could be very expensive. You can deduct that. Other people have incomes that are only slightly above the limit, $5, $10. For those people, it could be worth it to buy some cheap dental policy or a vision policy you might have seen advertised for $20 a month. Because paying that $20 a month, now you're saving the $148.50 Medicare Part B premium for this year. That's the Medicare savings programs. And I want to talk to you about a big issue in New York State for people that have Medicaid through the marketplace, Magi Medicaid, they refer to it as, that are becoming eligible for Medicare. So as you may know, the Affordable Care Act expanded the Medicaid program in New York State. They increased the income limits and they did away with the resource test. But that's for people that don't have Medicare. For people that do have Medicare, Medicaid still has a very low income limit plus a resource test. So what happens with the people that have Medicaid through the marketplace when they become 65? Well, prior to the pandemic, the normal process is they would refer your case from New York State to the local Department of Social Services, who would screen you for Medicaid and or the Medicare Savings Program. And then a lot of times people wound up losing Medicaid, not immediately, but after a few months. And during that few months that they still had Medicaid, they were entitled to reimbursement of the Part B premium. They paid the premium, and then they got a check from New York State. But that changed during the public health emergency. During the public health emergency, they're not transferring those cases to your local Department of Social Services. They're remaining with New York State. And people are remaining in their Medicaid managed care plan, even though they're becoming Medicare eligible. So what should these people do? Most important thing they should do is enroll in Medicare, Part A and Part B, because they cannot delay enrollment in Medicare without penalty because they're not covered through active employment. The other thing they should do is decide how they're going to get their Medicare, whether they want to enroll in a Part D plan with regular Medicare, or they want to enroll in a Medicare Advantage plan, including Part D. Now, these people get Medicaid. They have Medicaid when they become Medicare eligible. So automatically they get extra help with Part D, and they're going to be assigned to a Part D plan. But when the government assigns you to a Part D plan, it's just a random assignment. So it'd be much better if these individuals actively chose a Part D plan, which could be through a Medicare Advantage plan if they want. And then they're going to pay the Part B premium, but for the remainder of the time that they have Medicaid through the marketplace, they're entitled to the premium reimbursement. Okay, this referred to as MIP, MIPP, the Medicare insurance premium payment. So some people receive that automatically. Other people need to call the New York State of Health, the exchange, the marketplace to make that happen. And then once they're enrolled in Medicare, this is, of course, their Medicare Card, which shows you the two parts of Medicare. Part A, the hospital insurance, which covers them if they need to be admitted to a hospital or skilled nursing facility. And Part B, the medical insurance, which covers them mostly for doctor services and outpatient services at the hospital. Now, most people get Medicare Part A for free, for no premium, and Medicare Part B, they pay for. So this year, the standard Part B premium, we said $148.50 a month. But some people actually pay a higher premium because they have a higher income. And we're talking about people whose incomes this year above $88,000 single, $176,000 for a married couple. The way they determine that is Social Security. They work with the IRS and they look at your most recent tax return. For most everyone, they're basing your premium on your tax return from 2 years prior. So for 2021, they were looking at your 2019 return. And if your what they called modified adjusted gross income from 2019 was above that threshold, you're paying a higher Part B premium today as a result. Now, the good news is if you're paying a higher premium 1 year based on income, it doesn't necessarily mean that you will forever, because every year they're automatically going to reassess that. So for 2022, they're going to look at your 2020 return. And if your income is above the threshold, whatever the threshold might be for next year, we don't know yet, then you'll get a notice the end of this year that you'll pay a higher Part B premium for 2022 based on your 2020 return. But if you had what Social Security calls a life-changing event, a change in your marital status, more likely a change in your work status, you can appeal that to Social Security and ask them to base your premium, not on 2 years ago, but on the more recent tax year. As an example, I was speaking to a married couple. They both have Part B. Their income last year was very high because they both worked. This year, they both stopped working. Their income was much less. So I said, look out, the end of this year, you're going to get a notice from Social Security about paying a higher Part B premium for next year based on your 2020 return. You should then contact Social Security and tell them you have a life-changing event. And again, a change in work they recognize as a life-changing event. And instead of basing your premium for next year on 2020, you could ask them to base it on the more recent 2021 tax year. And as a result, they're going to save significantly on their Part B premium next year. Now, this is a chart to show you what the higher premiums are this year. Again, they have not announced the amounts or the thresholds for 2022 yet. And you'll see in the third column, for those that pay a higher Part B premium based on their income, if they also have a Part D drug plan, they pay an additional surcharge for that as well based on their income. It's paid in the same way as the Part B premium. If they're collecting Social Security, it's taken out of their check. If not, it's billed to them directly. So for those that choose original traditional Medicare, Part A hospital and Part B medical, these are the costs that they're responsible for. Under Part B, there's an annual deductible, $203 this year. Once they've met it, Medicare pays 80% of covered services for most services, and they're responsible for the other 20%, the Medicare co-insurance. On the Part A side, if they're admitted to the hospital, there's a large deductible for a hospital admission of up to 60 days. This year, $1,484. If they're in the hospital beyond 60 days, then there are additional amounts that they might be responsible for. Then I want to tell you about a change that happened with how Medicare pays for durable medical equipment. Right? There's competitive bidding. So for those that are in original Medicare this year who need an off-the-shelf as opposed to a custom back brace or a knee brace that live in one of these areas or visiting one of these areas, if they need these two items, they need to use a contracted supplier. And a contracted supplier they are mandated to accept Medicare's assignment, meaning they're mandated to accept whatever Medicare allows as their full payment. Now, if your client is on original Medicare and they need any other type of equipment, wheelchairs, walkers, hospital beds, anything besides these two categories, they can use any Medicare enrolled supplier. But just a word of warning, okay? If you use a supplier that does not accept assignment on a claim, unlike doctors, where you may know there's a limiting charge where they can charge no more than 15% above what Medicare allows if they don't accept assignment, with suppliers, there's no limiting charge protection at all. And they can charge the entire difference between what Medicare allows and what their usual charge is for that equipment and supply. Okay? So it's a really good idea if you ever need any equipment or supplies and you're on original Medicare to use a supplier that will accept assignment on the claim. And then we were talking earlier about the Medicare Savings Program. The one with the lowest income limits, the QMB program, not only does it pay the Part B premium, but it also works as a supplement to Medicare in that it eliminates any Part A or Part B cost sharing. So if your client also has QMB, it doesn't matter if they're in original Medicare or they're in a Medicare Advantage plan. They cannot be billed if they're in original Medicare for the 20%, if they're in a Medicare Advantage plan for a copay when they go to the doctor. Doesn't matter if the doctor takes Medicaid or if they ever heard of QMB. Doesn't matter if the doctor is getting paid anything with the QMB. Doesn't matter. They need to write it off. Okay, they cannot balance bill the individual. And sometimes people are not aware, providers as well are not aware of those protections. So I included a link to these 3 tips for people in the QMB, which beneficiaries can use if they have QMB and they're being billed incorrectly for a provider that does not realize that they're not responsible to pay for any Part A or Part B cost sharing amounts. So there are basically, you may know, 2 ways for people to get Medicare. Original traditional Medicare, Part A and Part B, or a Medicare Advantage plan. For those that choose original Medicare, we mentioned about some of the gaps in coverage, deductible, co-insurance. And for those people that have original Medicare that don't have retiree health insurance that may supplement Medicare, or who don't have Medicaid, they may want to purchase a private Medigap, a Medicare supplement plan. You've probably seen these advertised on TV from AARP. Medigap plans are identified by letter. There are 10 standard plans. This is the chart to show you each of the plans and the benefits they provide. Plans letters A through M. 2 things that are really important to know about Medigap insurance. First of all, the benefits are standard. So different insurers sell these plans. and they charge different amounts. But as long as it's the same letter plan, doesn't matter how much they're charging. It's exactly the same coverage. So if your client purchases Plan G, let's say from AARP, and somebody else purchases Plan G from Blue Cross Blue Shield, they charge different amounts for exactly the same plan. So it's well worth your while to shop around for the best deal on a Medigap plan. The other thing that's really important to know about Medigap insurance, in New York State, unlike most states, we have continuous open enrollment for Medigap insurance. So that means as long as you have Part A and Part B of Medicare, doesn't matter if you're over 65 or disabled with Medicare under 65, you can purchase a Medigap plan anytime at all. They can't limit you to only enrolling when you're first eligible or during certain times of the year. Not in New York State. Not only that, if you have a Medigap plan already and you live in New York State, you could always switch, if not with the same insurance company, by going to a different insurance company. You cannot be denied Medigap insurance because of your age or because of your health, not in New York. I want to tell you about a change that happened with Medigap insurance last year. You may notice that there are two plans here, Plan C and Plan F, that cover that Part B deductible. That's the 203 deductible I mentioned earlier. Those are the most comprehensive plans, but they're not available for sale to people that are new to Medicare. So if your client just became 65 this year, or they became 65 last year, they're not eligible to buy C or F. They can buy D or G, which is the same plan, it just doesn't cover the deductible, but C or F, they cannot. Okay? If your client, though, was eligible for Medicare prior to 2020, maybe they turned 65 in 2018 or 19, even if they didn't enroll until now because maybe they were still working or covered under a spouse is still working, when they get Part B, they can purchase C or F because they were eligible prior to 2020. But again, for the new people, the most comprehensive plan they can buy is Plan G. But Plan G could be expensive. If they're looking for a lower cost Medigap plan, I would then talk to them about Plan N. If you move from G to N, you'd be saving on the premium. But the big difference with Plan N is for office visits. So instead of covering the entire 20% coinsurance that Plan G and most plans do, for office visits with Plan N, you have a copayment of up to $20. Okay, but because you're paying for the copayment for the office visit, they're able to offer that plan at a lower premium. So that could be an attractive option, again, for people maybe that are new to Medicare, that are not anticipating as much in the way of medical expenses, and are looking for a lower cost plan. But the cheapest plans are the high deductible version of Plan F and Plan G. You see F and G have that asterisk next to it. That's because there's a second version of these plans. They cover everything the standard F or G covers, but before they pay anything, you have to meet a deductible. This year, the deductible is $2,370. Next year, it's going to be $2,490. So because you have to pay the first $2,370 in Medicare cost sharing this year out of pocket, that's how they're able to offer the Plan F and Plan G at the lowest premiums for Medigap plans that are available for sale. So if you want to see which companies offer which plans and the latest rates, you should be going to the New York State Department of Financial Services, dfs.ny.gov, where they have a chart they update every month to show you who sells which plans and their current premiums. And that's how you can make a comparison to see which Medigap plan. But remember, as long as it's the same letter plan, it's a standard benefit, okay, whoever's selling it and however much they're charging. Now, because Plan C and Plan F are not available to new people to Medicare, as a result, there's more and more people that have to pay that Part B deductible out of their pocket. So let me tell you how the deductible works. It's not necessarily applied to the first claim, to the first services a person has each year, I should say, but rather to the first claim or claims that Medicare receives. So sometimes people think when they go to the doctor at the beginning of the year, and they write them a check for $203, that means they've met the deductible. That's not how it works. The deductible is only met when claims are submitted to Medicare, processed, and applied to the deductible. So you might have a client that paid the doctor $203 for their first visit of the year, but then they go to another doctor. If Medicare gets that second claim for that second service first, they don't know that you went to the doctor earlier. They're going to apply it to the first claim that they get. And then you have to get a refund from the first doctor. But the first doctor is not even going to refund you the whole amount because they'll only be paid at 80% anyway. Just creates more confusion. So what I've always recommended is, unless the doctor is insistent upon collecting the deductible up front, don't pay it until you see how it's applied and where it's actually owed. And people can find that out 24/7 on the phone by calling Medicare, 1-800-Medicare. Okay? And again, it's becoming more of a problem because, again, the new people can't buy a plan that covers the Part B deductible, so they have to pay it out of their pocket. Plus, as the deductible goes up each year, it's more and more likely that you meet it not just on one claim, but on several claims. So if you're paying one doctor for the whole deductible and it was met on 3 different doctors' claims, okay, again, that's confusion that could be avoided if you wait to pay the deductible until you see where it's actually owed. So we spoke about original Medicare, which might come along with the Medigap, the Medicare supplement plan. This is the other way to get your Medicare, to join a Medicare Advantage plan. This is Medicare Part C. And most everybody's eligible to join a Medicare Advantage plan. You just have to have Part A and Part B of Medicare, and you need to live in the service area of the plan. That's it. Now, something that changed this year is that people that have Medicare that have end-stage renal disease, kidney failure, now have the option to enroll in a Medicare Advantage plan. Before this year, they could not. But although they could enroll in a Medicare Advantage plan, before they do, I would recommend that they check what it's going to cost them out of pocket for dialysis, which they may be receiving a few times a week. With a Medicare Advantage plan, they might have to pay 20% cost sharing for the dialysis, as opposed to original Medicare with the Medigap plan, where they can have, with most Medigap plans, 100% coverage for dialysis. So I think they should weigh that when they're thinking about whether they should enroll in the Advantage plan. Now, if they do enroll in an Advantage plan, or anyone does, it's important to remember they're not giving up their Medicare benefits. These private plans are required to cover whatever Medicare covers, plus as an incentive to join, they will cover to a limited extent some services Medicare does not pay for. So they typically provide limited coverage for things like dental, eyeglasses, towards a hearing aid. They might pay for a gym membership for that person, all things not covered by Medicare. And if you join a Medicare Advantage plan, it's also important to know that under most services, under most plans, are not covered at 100%. It's going to cost you something at the end of the day when you access care, usually a fixed copayment, or sometimes coinsurance, a percentage for most services under most plans. But in fairness to the plans, it's not an unlimited amount that you have out of pocket each year. All Medicare Advantage plans have a maximum out-of-pocket MOOP limit, not to exceed this year and next year, $7,550 in network with like an HMO plan, or $11,300 in and out of network combined with the PPO plan. So if you have a plan with the $7,550 limit, you go to a specialist, it's a $40 copay, the $40 is applied to the limit. You're admitted to the hospital, it's $300 a day for the first 3 days. The $900 out of your pocket is applied to the limit. If you reach the limit, most people won't, but if you do, 100% coverage for the rest of the year for all Part A and Part B covered services. These are the highest limits any plans can have. Some plans have the highest limits, some have lower limits, and that's something people may want to compare when they're looking at different Medicare Advantage plans. If they want to join a Medicare Advantage plan or switch, now is the time to do so. during the annual election period, okay, October 15th to December 7th, where they can make any change from one Advantage plan to another, to original Medicare, the other way around. If they're on original Medicare, they can change their Part D plan. And whatever change they make during this period will be effective January 1st. If they do choose a Medicare Advantage plan, they have a second enrollment period at the beginning of each year. It's called the open enrollment period. So every year from January through March, anybody that's on a Medicare Advantage plan can make another change to either another Medicare Advantage plan or to original Medicare to be effective the first of the following month. After March, for most people, whatever plan they're on, if they're on a plan at all, that's what they're going to have for the rest of the year. That open enrollment period is also available for people that are newly entitled to Medicare. If they take an Advantage plan when they're first eligible, as more and more people do around the state, they have the first 3 months of their entitlement to make a change. So for instance, if your client became 65 this month and they have A and B and an Advantage plan effective October 1st, for them it's like January. They have the first 3 months of their entitlement, October, November, December, in which they can move to another Advantage plan or to original Medicare. And that's a very important protection for them if they change their mind. And then I'll talk about Medicare Part D and EPIC in the next section. So for those that choose a Medicare Advantage plan, they get their Part D drug coverage for most everyone through that same plan. Because if you go with a Medicare Advantage plan, you get all your Medicare benefits, Part A hospital, Part B medical, Part D drug, all from the same plan. If instead you choose original Medicare with or without a Medigap plan, you can purchase a separate standalone drug plan to go along with that. And there are changes coming for that for 2022. So this year in New York State, we have 28 of those plans for people with original Medicare. Next year, we're going to have 19. And currently, there are 3 plans from Express Scripts. If your clients are in any of those plans, they're going to be moved. They're not going to be continuing next year. And they're going to be moving all the Express Scripts members automatically to Cigna. So they're your Express Scripts clients, they're going to get a new card and welcome letter from Cigna. They don't need to do anything. And that'll be their drug coverage for next year if they don't elect a different plan. And then the plans from Emblem Health, there are 2 plans that are just being terminated. They're ending the end of this year. Okay, so your clients that are in the Emblem Part D plans currently, those plans will not be continuing in 2022. And then there are going to be fewer, not only fewer Part D plans, but fewer what they call benchmark plans. So the benchmark plans are the plans that are available for no premium for people that get full extra help, including people that have both Medicare and Medicaid. So currently there are 7 of those plans. Next year there's going to be 4. And one plan in particular from Elixir is the name of the company, the Elixir RX Cure plan. Currently that's a benchmark plan, but next year the premium's going up, okay? And it will no longer be a benchmark plan. And for your clients that have full extra help, including those with Medicare and Medicaid, if they're on that plan for next year, the premium subsidy they get from the government will not cover the entire premium, and they may be responsible for a portion of that above the subsidy. And then we're hearing from a lot of members who have the other Elixir plan this year, the Elixir RX Plus Premium. That plan, the premium's increasing all the way from $1,560 this year to $5,150. Okay, a big increase for next year. And if they don't change their plan, okay, they're going to be responsible for that additional premium in 2022. So these are all things to look out for if you're assisting clients that are in any of these plans currently. And then there are some people who may be reassigned automatically to a different plan for next year. There's 2 reasons why somebody may be reassigned. On the bottom of the slide, you'll see people that are reassigned because their plan is terminated. So if you have clients that have extra help and they're on, for instance, that Emblem Part D plan that's not continuing for next year, if they do nothing, come January 1st, they're just going to assign them to a random benchmark plan because the people with extra help, okay, they don't allow them to be without Part D. And if their Part D plan goes away, they just put them in a different Part D plan. If they're in, though, that Elixir plan, that's a benchmark plan for this year, but is no longer a benchmark for next year, and they have full extra help, they may be reassigned. It all depends on whether they chose the plan. If they did not choose this Elixir plan, if the government just put them into the plan, they're going to be reassigned to a different benchmark plan for next year so that they would not need to pay a premium. But if they did not choose, if they did choose the plan, I should say, okay, if they did actively choose that Elixir plan they have currently, and it's a benchmark this year, but not for next year, they have full extra help. But the difference is, again, they chose the plan. They will not be reassigned. And if they don't choose on their own a benchmark plan for next year, they're going to wind up being responsible for the difference above the subsidy amount, which next year will be approximately $2.50 a month. And then there are special enrollment periods. Special enrollment periods are really the exceptions where people may be able to enroll or switch their Part D plan outside of this time of year, outside of the annual October 15th to December 7th. The most important special enrollment period to be aware of is the one for people with extra help. So all of your clients that have extra help, including people with Medicare and Medicaid, they can change their Part D plan, including Medicare Advantage plan with Part D, as often as once per calendar quarter in the first 9 months of the year. So they can change their plans once between January and March, once between April and June, once between July and September for their new plan to be effective the first of the following month. In this last quarter, they have the same October 15th to December 7th as anybody else. And then for the veterans that you're serving, they have a special enrollment period, not to enroll or switch, but to drop their Part D plan because they have the VA drug coverage. So this could be important for your veterans that are on a Medicare Advantage plan with Part D, and they want to switch to original Medicare. Okay? Most people can only do that during one of the enrollment periods, right? October 15th to December 7th or January through March. But the veterans can use this special enrollment period to disenroll from Part D, which for them means disenrolling from Medicare Advantage plan with Part D. Next month, they'll be on original Medicare, no Part D, but that's okay because they have the VA for their drug coverage. So for your veterans that are on a Medicare Advantage plan with Part D, and they want to move to original Medicare at any time of the year, there's no reason they need to be stuck in the Medicare Advantage plan. They can use this special enrollment period to allow them to make that change. And then for the people whose plan is terminating, okay, including the people that are in that emblem Part D plan, we said if they have extra help, they're going to be put in a new plan for next year. But if they don't have extra help, what's going to happen is if they don't choose a plan on their own, January 1st, they're going to find they have no Part D drug coverage at all. Luckily, there's a special enrollment period for them. It begins December 8th after the annual election period is over and runs through the end of February. So in case your client doesn't realize that their emblem plan was canceled until the first time they go to the pharmacy in January or February, they can still use this to special enrollment period to enroll in a different plan to be effective the first of the following month. So they don't need to be without drug coverage for the rest of the year. And then I'll just tell you about two other special enrollment periods. One is for people that are institutionalized. So by institutionalized, it could mean people that are in a nursing home, or it could also mean people that are in a skilled nursing facility for rehab. Okay? People's needs may have changed while they're there. This special enrollment period allows them to make a change in how they get their Medicare while they're in the facility or within 2 months following the month of discharge. In addition, there's a special enrollment period for people that are impacted by a government-declared disaster. So you might live in an area where there was a government-declared disaster, or you might not, but you might rely on a family member who lives in that area. And if you had another enrollment period available during the disaster, but you didn't use it because of this, you can have a special enrollment period where you'd be able to use the enrollment period after the disaster is passed, and you have the ability to make that change. So this is just a sample of the different special enrollment periods that are available. There are many other situations that would allow for a special enrollment period. So I included a link to a reference there, Understanding Medicare Advantage and Medicare Drug Plan Enrollment Periods, for more detailed information. Then I want to tell you about protection that's available for people that have Medicare Part D that have extra help also. And it's called Best Available Evidence. So people that have extra help, especially those with Medicare and Medicaid, may only pay very small copayments for their drugs. But sometimes the Part D plan that they're in is not aware of their extra help status. And instead of being charged those small copayments, they're being charged much larger amounts at the pharmacy. But you know the person has extra help because you're looking at their Medicaid card or their Medicare Savings Program award letter or Social Security extra help award letter. Well, in that case, you can call the Part D plan, quote this best available evidence, and fax them proof the person has extra help in the form of their Medicaid or Medicare Savings Program award letter, for instance. And then the plan right away has to provide the drugs at the correct copay level so that your client doesn't need to be turned away at the pharmacy because they can't afford the full cost sharing under the plan, which they should be paying in the first place because they have extra help. Another protection, which is really important, especially at the beginning of each year, is called transition. So you might have a client that's taking a drug today and the plan is covering it, no problem. But next year, their new plan or the same plan they're in is no longer covering that drug. Or they do cover the drug, but now there are restrictions on the medications like prior authorization and step therapy that make it harder to get that drug covered. If that's the case, the government does not want there to be an interruption in your drug regimen at the beginning of the year. So in that case, all Part D plans have to provide a temporary one-time 30-day transition fill. And during that 30 days, the person needs to act. If they qualify for an enrollment period, they can switch to a plan that hopefully covers all their drugs. Or if not, then what they can do is they'd have to work with their doctor to see if the doctor could prescribe something else that is on the plan formulary that could be covered. Or if not, with the doctor's help to request an appeal, an exception, where if the doctor can prove to the plan that that's the one drug necessary for them, then the plan would have to cover that at least through the calendar year. Now, when we talk about exceptions, usually we're thinking of the drugs that are not on the formulary, that the plan doesn't cover. But sometimes there are other types of exceptions, tiering exceptions, where the drug is covered by the plan, but the problem is it's covered at a high tier, a high level, and that means it's covered with a high cost sharing. There are drugs for the same condition the plan covers at a lower tier with lower cost sharing. And if the doctor can prove to the plan that the drugs under the lower tier are not as effective, then the tiering exception is to request the higher tier drugs to be covered at the lower tier cost sharing amount. And for some people, that can result in a significant saving on their Part D drug costs. Now, currently, this can only be done for people to request a tiering exception for preferred, non-preferred specialty drugs to be covered at the preferred specialty tier. Now, you cannot request to have drugs covered at the low generic tier or for specialty tier drugs, which are very expensive drugs where you might have coinsurance up to 33%. Specialty tier drugs you cannot request either to be covered at a lower tier. Again, it's only currently for non-preferred specialty, non-preferred brand, I should say, to be covered at preferred brand tier rate. But next year, some plans might have a second specialty tier. And if they do, a preferred specialty tier, you can request for the non-preferred specialty tier drugs to be covered at the preferred specialty tier rate. And because these are very expensive medications, that might represent a significant cost sharing for any plans that might have a second specialty tier in 2022. And that would be something new for Part D. Okay, and then the most important thing to talk to you about today probably is Epic. So for those that don't know, Epic is New York State's pharmaceutical assistance program. It's for New York State residents that are 65 and over, that have incomes of up to $75,000 for a single person, up to $100,000 for a married couple. Like the Medicare savings programs in New York State, they don't look at your assets or resources, only income to qualify. And they would base your eligibility on your total income from the previous year. So if you're applying today, they would look at your 2020 income. Epic has two plans. For lower income individuals, they would be in the fee plan, where they'll pay a fee or premium on a sliding scale based on their income to be a member. But most people today would be in Epic's deductible plan, in which case Epic will be free, but they'll have to meet a deductible on a sliding scale before Epic will help pay for their drugs. And then Epic does not work on its own. Epic only works as a supplement to the Part D plan. And the Part D plan, it can work with any plan. You could have a Part D plan through your Medicare Advantage plan or a separate one with original Medicare. It's all Part D, where Part D, again, is your primary insurance. Epic wraps around. Epic helps to fill in the gaps in coverage. In addition, Epic for lower income individuals can help pay your Medicare Part D plan premium up to the benchmark amount, $42.43 per month next year. Or for most members that are in the Epic deductible plan, Epic will reduce the published deductible by $510 next year. And what I would say for the clients that have Part D that are eligible for Epic and would be in the Epic deductible plan, people that have incomes $30,000, $40,000, $50,000, $60,000, I don't see any reason for them not to sign up for Epic. Because even if they don't meet the deductible, they still have Epic in place should their situation change. And let me tell you another benefit of Epic. We were talking about special enrollment periods before. Epic members have their own special enrollment period where they can make one change per year, okay, outside of the different Medicare enrollment periods. So for some people, it's worth it to join Epic just to be able to change their Part D or Medicare Advantage plan without having to wait for the next year. And you can apply for Epic at any time. Anytime. You cannot apply online. You can download the application online and fill it in, but you'll need to mail or fax that to Epic. And Epic has a new application. So this is the link to it here. And you'll notice on the application that Epic is asking for current income and resources, assets. Now, Epic doesn't need that to determine eligibility. They base it on last year's income, prior year's income. But the reason they're asking for that information is because Epic is screening their members, new members, to see if they may be eligible for extra help, the low income subsidy to help with their Part D drug costs. And what Epic does, if they feel that their member may be eligible, is they're applying on the member's behalf to Social Security for extra help. And to do so, they need that information, okay? Current income and resources. But during the pandemic, what they've been doing is they're allowing people to use the new application or still use the old application. But if they use the new application, they can just leave out those lines 4 to 23, where they're asking for that additional information. And then if it appears you may be eligible for the assistance, Epic will just send you a form later to see if you may be eligible to get that information from you to apply to Social Security on your behalf for extra help. And then the other thing they've been doing during the public health emergency is they've not been canceling their fee plan members for non-payment. So ordinarily, people that are in the fee plan, if they have full extra help, Epic waives the fee. But if they don't, they're responsible for a fee or premium. And if they don't pay it by a grace period, they're canceled. But during the public health emergency, Epic has not been canceling members for non-payment. And what they've been doing instead is they add the unpaid balance to the next premium bill, the next fee plan bill. So you might have clients that have a bill for multiple quarters of unpaid Epic fees, okay, that they're responsible for. And we don't know when Epic will return to canceling members for non-payment. Okay, so that's the information I have today. I know it was a lot of details that we covered. So I'm happy to take any questions that you might have on anything we covered or anything else relating to Medicare.
Thank you. Thank you so much, Eric. Just going to ask you to stop sharing so we can see everybody and see if anybody has a question. There you go. Thank you. That was so much information. Thank you so much. Does anybody have any questions? I just put both of their presentations in the chat, so you can grab them out of the chat if you'd like.
So I'll also, for you and for your client, if there are any questions, in addition to the New York Statewide Senior Action Council that has counselors that answer questions, the HICAP program, HIICAP, also has a network of counselors throughout the state that answer questions on Medicare and related health insurance. So if you've seen clients that have gotten the Medicare and You handbook for 2022 in the mail, the phone number for HICAP appears on the back, that 800-701-0501. And then if you call and enter your zip code, it'll direct you usually to the local county office for aging, where HICAP is in most counties.
And Taylor Kuzal, she used to be with Alzheimer's Association. She has taken over Myrna's position at the county office for aging. So if anyone has questions, she should be available there. Any other questions? Well, if not, that's okay. Like I said, I put both of their information, their talks in the chat. And if you have any questions, you can send them to me and I will forward them on to the appropriate person. But other than that, thank you so much, Sarah and Eric, for your information, and I really appreciate it.
Hey, thank you.
Thank you so much for having us.
Thank you.